Good morning. Welcome to Dementia Q&A. I'm Dr. Marc, internist and geriatrician. Today's question: how many types of dementia are there? I could make an enormous laundry list for you of all the types of dementia, but I don't think that would be a good use of your time. Instead, what I want to do is I want to take you through the 5 major categories of dementia that I'm always thinking about when I'm seeing a new patient or family. We'll go from the most common to the least. The first category is Alzheimer's dementia. By far the most common, about 55 to 65% of new cases will be Alzheimer's. Common early symptoms are short-term memory loss, difficulty learning and remembering new things that we might have done or talked about this morning, or yesterday, or the past few days. Other early problems might be difficulty naming people, places, even objects. And sometimes difficulty with orientation, not knowing what day or week or month or even what season it is. The second most common type of dementias are the vascular dementias. These can occur alone or in combination with Alzheimer's, in which case it's called mixed dementia. The vascular dementias occur because of tiny little blood vessels in the brain that essentially get clogged or closed, just like a stroke. When it's those tiny little blood vessels, we call them lacunar strokes or mini strokes. When it's in a larger blood vessel, that's obviously something we might see happening right in front of us. That's a stroke, a major emergency. Sometimes the smaller little blood vessels, we don't even know that it's happening, and we only pick up the signs and symptoms later. Vascular dementia accounts for about 20 to 25% of all new dementias, and the early symptoms are, along with memory loss, difficulty with getting things done, completing tasks. That might happen at work, for example, where someone's having trouble being organized enough to get things completed. Also, people might have trouble finding the right words in a variety of sentences. Another interesting early symptom of the vascular dementias tends to be depression. We don't quite understand why that is, but that's a tip-off, along with memory loss and cardiovascular disease, that it might be a vascular dementia, not just Alzheimer's. The third most common type of dementia are those dementias that travel together with signs and symptoms of Parkinson's disease. The most common of those is Lewy body dementia. It accounts for about 10 to 15% of all new cases. Early symptoms, along with memory loss, are problems with movement, rigidity in the arms or the legs, trouble with gait and balance that might lead to a multiple number of falls, and sometimes, occasionally, early visual hallucinations, which can be incredibly distressing for the patient and for the family. That's not to say that in the Alzheimer's dementias you can't have visual hallucinations. You can, but they tend to come much later in the disease, whereas very early hallucinations might be a tip-off that it's a Lewy body type. The fourth category of dementias are what are called the frontotemporal dementias. Much rarer. They only account for about 5% of all new cases, and they're named because that part of the brain, the frontal and temporal parts of the brain, tend to control our personalities, our behavior, our self-awareness, and our ability to plan and execute very complicated tasks. Early signs and symptoms, aside from memory loss, might be very abnormal behavior. Things like loud, gregarious talking in public when the person was generally pretty reserved, or repeatedly asking the same question every 10 or 20 seconds, almost like a tic. Also, people might become disheveled because they're not self-aware of their appearance. The fifth and last category of dementias that I'm thinking about are essentially all of the dementias that don't fall into the other 4 categories. I think of these in 2 buckets. They all account for less than 1, 2, or 3% of all the new cases. Some dementias are the effects of other diseases, things like Huntington's disease, syphilis, HIV and AIDS, Down syndrome, or heavy chronic alcohol abuse. The other category are those very small number of dementias that are reversible, meaning curable. These tend to be very, very severe B12 deficiency, very, very severe hypothyroidism, or something called normal pressure hydrocephalus, which has a triad of symptoms that we're always on the lookout for, because if we find it, we might be able to reverse it. I hope that these categories of dementia are helpful for you as you think about a diagnosis in a loved one or are working with a physician on yourself. If you have questions about dementia you'd like a geriatrician to try to answer, please put it in the comments section. And if you've liked or shared the page or subscribed, it's greatly appreciated. Thank you so much for joining, and I look forward to seeing you next week.